Hi everyone, I'm in my home here in Massachusetts. Bruce and I drove back from DC yesterday after Congress passed a huge stimulus package. Look, it wasn't the bill I would have written, but we face a public health crisis that threatens to cause a Great Depression. Families and hospitals and small businesses need immediate help, and the bill's immediate investments are vital. But be clear, they are not enough. We're going to need more, and we're going to need it soon. First, restarting our economy is going to take one thing above all else: testing. As we've seen, countries that had widespread testing early on have thus far stemmed the spread of the virus, and they've helped people get back to work. Look at South Korea, for example. They developed expansive testing early on, and they were able to track and quarantine infected people without having to shut down their cities. Here in the US, we are far from that. The Trump administration recently said they would use the Defense Production Act to make 60,000 test kits, and the stimulus provided $1 billion to get that done. But a country of 330 million people needs more than 60,000 test kits. And besides that, there are other supplies that are needed when you test, like masks and cotton swabs, and those are in short supply as well. So here's what Congress should do. First, we should pass legislation to require the Trump administration to act to produce these critical supplies. It's a bill I just signed on to with Senator Baldwin. Second, the federal government should fund both the production and the distribution of these tests all across the country. Third, the federal government should fund the training of workers who are able to perform these diagnostic tests. We can prioritize hiring people who've been laid off because of COVID-19. And finally, Congress must increase the transparency of testing. The Department of Health and Human Services should be required to report the demographic information of individuals tested to be sure that the resources are being distributed fairly. Our healthcare professionals are on the front lines in this crisis, and we need to do everything we can to support them. That means producing more tests and supplies. And until the Trump administration takes real action, it means to continue to practice social distancing so our hospitals are not overrun. So that's where we are right now. I want to hear from you. Let me know how you're staying safe or what questions you have. Reply here, and I'll take a look, and I'll get back to you next week. And in the meantime, stay safe.